The relationship between human beings and germs, microbes, bacteria, viruses, is profoundly affected by climate.
Climate change affects the natural processes which we depend on for our survival: food, air, water, physical protection, and constraints for infectious diseases. Health hazards from climate change are diverse and global. It will be very difficult to revert their impact on our human health. The climate is indisputable that is changing, and this will have a human cost. In 2003, the disastrous heat wave that occurred in Europe killed 70,000 people. But lessons were learned, and the heat plans put in place in France in 2006 helped us to avoid over 4,000 deaths.
There is a direct linkage between global warming and increased threats to human health. Solving the climate crisis can help to improve human health.
More than 25% of the global burden of diseases could be prevented by investments in our environment. Many diseases are linked to energy consumption and transport systems. And by changing those transport system and energy consumptions, we can reduce climate change and at the same time produce a lot of health benefits. It is not just a transfer where we will make a difference. Alternative energy sources will produce a lot of health benefits. The amazing thing is that challenging climate change is cost effective. The money we can save by reducing the healthcare cost caused by environmental risk like respiratory diseases and air pollution will exceed the cost of addressing those environmental risks.
It is in developing countries where many of the threats associated with the climate crisis are most troublesome, because developing countries are less likely to have the budgets and institutions for the public health responses that are necessary.
The most vulnerable people are those living in countries with very weak health systems, particularly developing countries. Malaria and dengue are examples of infectious diseases that are spreading now, particularly in places where we didn't see it before, like in Africa, highland. In Africa, many countries have a high burden of climate-sensitive diseases and very poor capacities to respond.